This morning, we are talking about a heart condition that affects millions of people, atrial fibrillation, or a-fib. It's a serious heart condition that causes an abnormal heart rhythm. According to the American Heart Association, 12 million Americans will have the condition by 2030. Dr. Nidhi Kumar is on call to tell us more about atrial fibrillation, what you can do to prevent it. Good to see you, Dr. Kumar. Thank you so much. First things first, what is a-fib?
Well, a-fib is an abnormal heart rhythm in which the atria, which are the upper chambers of the heart, start to beat rapidly, chaotically, and out of sync with the rest of the heart. Now, this interferes with the heart's ability to pump blood to the body. Symptoms can be palpitation, shortness of breath, fatigue, dizziness, but why it's so important for us to talk about this is that atrial fibrillation can lead to stroke. It can lead to heart failure. It can even lead to dementia.
So, what causes a-fib?
Well, as we get older, our chances of having atrial fibrillation increase. In fact, lifetime risk is about 20%. But there are certain things that put us at a higher risk. Uncontrolled blood pressure, untreated sleep apnea, obesity, vaping, excessive alcohol use, and even certain respiratory infections like having a bad case of influenza or COVID. I mean, that's why we say get vaccinated, because that keeps those complications down.
All right, what if somebody does have a-fib? How is that treated?
Well, for patients that have newly diagnosed atrial fibrillation, doctors may consider cardioversion, where we actually shock the heart back into a normal rhythm. There are medications to treat atrial fibrillation. Anticoagulation or blood thinners are very important because that lower our risk of stroke. And just recently, the FDA has approved a new ablation procedure where we actually send high energy electrical currents into the heart to target those cells that are misbehaving and causing atrial fibrillation.
But before we get to that, how can people just prevent a-fib from happening to begin with?
Right, it's prevention. Okay, so I mean, it all starts with healthy lifestyle, good weight management, exercise, low alcohol consumption. You need to treat your blood pressure. Don't ignore your blood pressure numbers. We've been talking about that all month. And then for all of you out there who snore at night, get checked for sleep apnea. Sleep apnea is one of the leading causes of atrial fibrillation. People don't realize it. And if you're a snorer, that may clue you in that you have sleep apnea.
So why is that? I mean, what is the connection between the snoring and the a-fib?
Well, so when people have actual sleep apnea, they're having periods of the night where their oxygen level is dropping down quite significantly, and that puts a major stressor on the heart. And then that becomes a risk factor for developing atrial fibrillation.
And then you get the lack of sleep along with it, and then other problems that come along with all of this. All right, well, Dr. Kumar, thank you so much for talking with us this morning. We really appreciate it. And you can catch Dr. Nidhi Kumar's reports. That's every Monday, streaming live in our 7 a.m. hour.